Hey, welcome back to Following Signs. I'm your host, Ruto Parl, and today I'm going to be diving deep into a topic that affects millions of people worldwide, arthritis. Arthritis is not just a single disease, but a broad term that encompasses over 100 different types of joint diseases and conditions. Today, we're going to explore what it is, its causes, symptoms, treatment options, and how to manage living with this condition. So, let's get right into it. Now, to begin, let's define arthritis. Arthritis is an umbrella term used to describe inflammation of the joints. It can affect one joint or multiple joints. The most common types are OA and RA. OA is often referred to as the wear and tear arthritis. It occurs when protective cartilage that cushions the ends of your bones wears down over time. This type of arthritis typically affects the knees, hips, lower back, and hands. RA, on the other hand, is an autoimmune disorder. In RA, the immune system mistakenly attacks the body's tissues, specifically the synovium, which is the lining of the membranes that surround the joints. This results in inflammation that can destroy joint cartilage and bone over time. Other types of arthritis include psoriatic arthritis, gout, and lupus-related arthritis. Psoriatic arthritis is an inflammatory joint disease associated with psoriasis. Gout is caused by the accumulation of urate crystals within the joint, leading to sudden and severe pain. Lupus-related arthritis occurs in people with lupus, an autoimmune disease that can affect multiple organs. Now, each type of arthritis affects the body differently and requires unique treatment approaches. Now let's talk about the causes and risk factors associated with arthritis. For OA, the primary cause is mechanical wear and tear of the joints. Over time, the cartilage that cushions the joints can deteriorate. This type of arthritis often develops gradually, with symptoms worsening over the years. Risk factors for OA include aging, joint injuries, obesity, and repetitive stress on the joints from certain occupations or sports. For examples, athletes who put continuous stress on their joints or people with jobs that require repetitive motion are at a higher risk. RA, however, is caused by an autoimmune response where the immune system attacks the synovium. The exact cause of RA is unknown, but it is believed to involve a combination of genetic and environmental factors. Certain genetic markers like the HLA-DR4 allele are associated with an increased risk of developing RA. Environmental factors such as smoking, exposure to silica, and certain infections can also trigger the disease in genetically predisposed individuals. Risk factors for RA include being female, a family history of RA, smoking, and age. Now, it's important to understand that while some risk factors like age and genetics cannot be changed, lifestyle choices can play a significant role in managing and potentially reducing the risk of arthritis. Maintaining a healthy weight, avoiding joint injuries, and not smoking are critical preventive measures. Now, let's discuss the symptoms and how arthritis is diagnosed. Common symptoms of arthritis include joint pain, stiffness, swelling, and a decreased range of motion. These symptoms can vary depending on a type of arthritis. For example, in OA, pain typically worsens with activity and improves with rest, while in RA, joint pain and stiffness are often worse in the morning or after periods of inactivity. Other symptoms of RA can include fatigue, fever, and loss of appetite. Now, diagnosing arthritis begins with a thorough medical history and physical examination. During the physical exam, doctors check for swollen joints, redness, warmth, and movement limitations. Your doctor may also ask about the severity and timing of your symptoms, as well as any family history of arthritis or other autoimmune diseases. Blood tests are also commonly used to diagnose RA. These tests can look for markers of inflammation such as PCR and C-reactive protein. Specific antibodies such as RF and anti-CCP can also be indicators of RA. Now, imaging tests like X-rays, MRIs, and ultrasounds help assess the extent of joint damage and inflammation. X-rays can reveal joint space narrowing, bone spurs, and other changes associated with osteoarthritis. MRIs and ultrasounds provide a more detailed view of soft tissues, including the synovium, cartilage, and tendons, which are particularly useful in diagnosing and monitoring RA. Now, early diagnosis and treatment are crucial for managing arthritis effectively and preventing further joint damage. If you experience persistent joint pain or stiffness, it is important to seek medical advice promptly. Now, let's delve deeper into the biological and molecular details of arthritis. In osteoarthritis, the primary issue is the breakdown of cartilage, the firm, slippery tissue that allows the near frictionless joint motion. As cartilage deteriorates, bones begin to rub together against each other. Now, this causes pain, swelling, and reduced motion. The process involves inflammatory cytokines such as IL-1 and TNF-A, which contribute to cartilage degradation. Now, additionally, enzymes called MMPs break down collagen, a key component of cartilage. Changes also occur in the subcondylar bone, which is a layer of the bone just below the cartilage. In OA, this bone can become thickened and develop bone outgrowths called bone spurs or osteophytes. These changes can lead to further joint pain and stiffness. Now, let's go more in detail about RA specifically. RA involves a more complex autoimmune process. The immune system mistakenly targets the synovium, causing chronic inflammation. This leads to the proliferation of synovial cells, forming a thickened layer of tissue called pannus. This pannus invades and destroys cartilage and bones within the joint. Now, key players in this process include T cells and B cells. T cells release cytokines like TNF-A and IL-6, which perpetuate inflammation and recruit other immune cells to the joint. B cells produce autoantibodies such as RF and anti-CCP, which can form immune complexes that further drive the inflammatory response. Now, the chronic inflammation in RA also leads to the production of destructive enzymes such as MMPs and cathepsins, which degrade cartilage and bone. Additionally, the prolonged inflammatory environment can cause systematic symptoms including fatigue, anemia, and increased cardiovascular risk. Understanding these biological mechanisms helps in developing targeted treatments to manage and potentially modify the disease course. For example, medications that inhibit specific cytokines such as TNF inhibitors and IL-6 inhibitors can effectively reduce inflammation and slow the progression of RA. Now, moving on to treatment options, there are various ways to manage arthritis, depending on the type and severity. For osteoarthritis, over-the-counter pain relievers such as acetaminophen and NSAIDs, like ibuprofen, can help manage pain and inflammation. In more severe cases, doctors may prescribe stronger medications such as opioids or just corticosteroid injections to reduce inflammation. Now, RA requires a more aggressive approach with DMARDs, such as methotrexate, sulfasalazine, and hydroxychloroquine. These medications can slow the progression of the disease and prevent joint damage. Biological response modifiers can target specific cytokines like TNF inhibitors and IL-6 inhibitors. And they've also shown to be effective in managing RA by reducing inflammation and halting disease progression. Janus kinase or JAK inhibitors, such as baricitinib, are newer options that block specific pathways involved in inflammatory processes. Now, you can also use therapies. Physical therapy can help improve joint function and mobility through targeted exercises that can strengthen the muscles around the joints and enhance flexibility. Occupational therapy can assist in adapting daily activities to minimize stress on the joints. For example, an occupational therapist might suggest using ergonomic tools and adaptive devices like jar openers, reachers, and splints to make daily tasks easier and less painful. You can also implement lifestyle changes. By doing regular low-impact exercises such as swimming, cycling, and walking, you can strengthen your muscles around the joints and improve flexibility. Maintaining a healthy weight is also crucial as it reduces the load on weight-bearing joints such as the knees and hips. A balanced diet rich in anti-inflammatory foods like fruits and vegetables, whole grains, and omega-3 fatty acids found in fish can also be beneficial. Foods with anti-inflammatory properties such as turmeric and ginger may also provide additional relief. And lastly, you can go for some surgical options. In cases where conservative treatments are not effective, surgical options like joint replacement surgery or arthroscopy may be considered. Joint replacement involves replacing the damaged joint with an artificial one, which can significantly reduce pain and improve function. Commonly replaced joints include the hip, knee, and shoulder. Arthroscopy, a minimally invasive procedure, allows surgeons to clean out joint debris, repair torn cartilage, or smooth rough surfaces, provide relief for certain types of arthritis. So basically, it's a really good option if different conservative treatments are not effective, like I mentioned before. Now, each treatment plan should, of course, be individualized based on the type and sensitivity of the arthritis, as well as the patient's overall health and lifestyle. It's essential to work closely with healthcare providers to determine the best approach for managing arthritis. Now, that brings us to the end of today's episode on arthritis. I hope you found this episode and this information I provided helpful and empowering. Remember, arthritis is a manageable condition, and you, with the right approach, can lead a fulfilling life if, of course, you have it. Now, of course, if you have any questions or topics you would like me to cover in future episodes, feel free to comment down below. Thank you for listening, and until next time, stay healthy and stay informed. And of course, don't forget to subscribe and leave a review. Your feedback helps me bring you more valuable content. Now that's it for today. This is your host, Ruto Paro, signing off.